Stretching and flexibility are important elements to your chiropractic care. They actually help in keeping your adjustments. Through his close work with chiropractic patients, Sam Jacoby put together a special stretching routine that helps to keep one's body stay more aligned in between visits. So let me go change, clear the floor, and help out Sam in helping you maintain better form. And with that, of course, better health. Here's some stretches that you can do at your home or at your gym, anywhere to keep your chiropractic adjustments. We're going to make it real simple. Start at the top of the body at the neck. And what we're going to do is we're going to open up the neck. There's a webbing that goes throughout our whole body, and they call that fascia. But this webbing, this can either be lengthened or shortened. When it's shortened, it's a bad thing. It can throw your chiropractic adjustment off. If it's lengthened, you'll move better and you're stronger and you're a lot more vibrant. I'm going to start with that head. We're just going to rotate in both directions. And when you're doing this, just kind of think of about 3 to 5 rotations per side. And if it feels good, do it more. If it feels a little stiff, just chip away at it. You don't want to overstretch because that's also a problem with stretching. The second thing we're going to do is same thing. We're going to rotate around the hip, opening up that low back, your SI joints, which your chiropractor's familiar with, but all the great areas that seem to go out if you're sitting for too long or in a long commute. The following stretches here at the knees. Just do nice little rotations. Do about 5 to 10 of these. Just get the fluids in the knee joints lubricated. You don't want to have stiff knees. Now from here, we're going to go into our back. This is right here, we all know it as our chicken wing. It's really your scapula. And this right here can actually get stuck against that rib cage. You want to open that up. So we're going to take this and pull that across that body. So that open that up. So you're going here and pull it open. You want to hold each of these stretches for about 10 seconds long. And you want to do it on both sides. And again, if it feels good, keep stretching it. If it's a little stiff, then just work your way into it. The next following stretches we're going to do is going to be in our chest, opening up that webbing here, and that helps keep the ribs open. You've heard of popping a rib head out. It doesn't feel good when you're trying to breathe. This helps keep everything lengthened. And then from there, we're going to go right into our biceps. So this one goes on the floor. You're going to start with putting your hands straight out to the side. I want you to push away and open up that chest. Now this is kind of a unique stretch for most people, so just go into it really slow. Don't overdo it. And you're going to do that on both sides. Hold that stretch for about 10 seconds. And then the same thing, hand out, rotate on that index finger, same movement, but you're going to feel it in a different area. You're going to feel it right in that biceps, right in this little guy here. The next couple of stretches we're going to do, and they're going to be on your back, okay? We're going to open up your low back. It always feels good to have a nice released low back, but you can also maintain it through this stretch, and that webbing's very tight in that area. We're going to pull your knees right to your chest. Make sure you're breathing. A huge part of stretching is your breath. And we're going to do on both sides. You're going to open up, pull that knee right to your chest, and open up the leg. It hits your hip flexors as well. That's an area right here. Putting your knees together, you're going to open up your hands, drop your knees to one side, your head goes the opposite way, and this opens up this whole area here. And if you've ever heard of your IT band, that's what they're talking about. They're talking about that sheath here that connects that hip to that knee bone. You don't want a tight IT band because that causes problems in the hip joint. You're going to do that on both sides. See how I rotate away from my knees? Open all that up. And then we're going to do a deeper stretch here in this area here. And that they call this the reclined pigeon. You're going to pull your knee in tight, stretch forward, and just open up those piriformis areas. And that's right in here. Nice and strong. And you're going to hit both sides the same way. Hold this stretch for another 10 to 15 seconds. Just they're bigger muscle groups. You want to spend a little bit more time letting those release. Let me get assistance from Kelly. I'm going to show you how to do these same stretches with a partner. So we're gonna have Kelly lay right on your back there.
You're going to abuse me, I know.
So this one right here, same thing, you're holding your stretches 10 to 20 seconds. Again, if they say it feels good, just keep holding that stretch. If it's hard for them, just work their way into it. But the first one here, we're gonna go knees to the chest. There you go, make sure you remind your partner just to breathe, relax.
Oh yeah.
Allow that low back to open up. From here, we're gonna keep the knees tight together, pushing on the knee and the hips as you push it all the way down, and just remind them to look the opposite way as they breathe, and that'll help open all of this up. A lot of times you'll actually hear or feel adjustments or those subluxations, the little crackling going on.
Oh yeah. I'm gonna look the other way again, opposite?
Yep, then look the opposite way as you get into that stretch there. And I stretched Kelly earlier, and he's a lot more loose now. So you can see how quickly one can get stretched. That's why it's so important to do it once, twice, 3 times, 10 times a day if you have the time. This next stretch here, we're going to basically open up his IT band, that area right here. You take your leg across the body, use your opposite leg to push that forward, and you get that nice stretch. And that's opening all of that up. Again, lengthening that webbing so that your adjustment will stay in place where you want it to be until the next time you get adjusted. This is what it looks like on this side here. And another thing that I think is very beneficial, we're always up on our hips, doing traction. What that is you're pulling the extremity, in this case it's your leg, out of the hip joint. You're giving it a little bit of relief because we're always on your hip joints. Gravity has a way of giving us compression. So what I do is I use his other leg as a base or an anchor, and I just pull on that leg until I feel it relax. I even rotate it, get some of that fluid in there. They call it synovial fluid. And I like to do it on both sides, keep the body balanced. And then another stretch I like to do is back here in the hamstrings. And what we're going to do here, you just open that up. See how his opposite leg is kind of moving? That means his hammies are tight. It ain't right when it's that tight. All right, we're going to go this side here. Okay. Let's hit the other side. And same thing. This is a real nice stretch for that hamstring. Tight hams mean a sore back means tight hamstring, so you want to keep all that lengthened and loosened.
Wow, you're right.
You have a sore low back sometimes?
No, not for a while.
Okay, good. Perfect. All right, come on up.
All right.
Good job, Kelly.
So, good for what age? I mean, anybody?
Yeah, this stretching, especially the routine I just showed you, anybody from ages 1 to 100. And in fact, everyone should be doing this. So you want to keep that webbing really lax and loose all the days of your life.
What do you mean by webbing then? I picture a spider, so I'm not really sure what you mean by webbing.
That's a good question. So with the webbing, think about the last time you bought a piece of steak, and you see that white material that goes in between and webs in between the steak. That's the webbing I'm talking about, and that goes from your nose to your toes. It fills your whole body up. So if you get in an accident, 9 times out of 10, it's going to be several areas of the body, not just right where it's manifesting or where it hurts.
Okay, so just basically, we're just trying to get all that stretched out and spread out.
Yep.
So, and you were talking earlier, we've been talking about this. The older we get, the more stretching actually helps us, I guess, live longer, right?
Yes, exactly. The older you get, the more shortened it gets because we get less and less active.
I've seen that.
So you want to keep your body moving, take like a Tai Chi or a yoga class, and just keep everything opened up and loose.
Sounds great. Thanks, Sam.
Great, thank
you.
Right.
Well, I got to change, and I'll be right back.